Have you ever felt a strange tingling in your legs? Or maybe your feet get cold for no reason. Your ankles swell, or you notice a dull ache in your chest. These might seem like minor issues, but for many seniors, they can be the first signs of poor circulation, something that can seriously impact your health if ignored. Poor circulation doesn't just make your hands and feet feel cold, it can lead to numbness, muscle cramps, and even memory problems. But what's really happening inside your body? Well, your blood is supposed to flow smoothly through your veins and arteries, delivering oxygen and nutrients to every part of you. But when these pathways get blocked or narrowed, everything changes. Today we're going to uncover the truth about poor circulation. We're not just talking about clogged veins. We'll also explain how your arteries and even your lymphatic vessels play a crucial role in keeping your blood moving properly. Understanding this is the first step to protecting your health. So, if you've ever noticed your feet turning cold, your legs feeling heavy, or even experiencing strange tingling in your fingers, stay with us. In this video, we'll help you recognize the symptoms, understand what causes them, and most importantly, show you natural ways to restore your circulation and protect your health. Have you ever experienced any of these signs? Tell us in the comments below. And if you're ready to learn how to keep your circulation strong and healthy, make sure to subscribe for more powerful tips. The circulatory system is one of the most vital networks in your body, ensuring that every cell receives the oxygen and nutrients it needs, while removing waste products. But how exactly does this complex system work? It all comes down to three main types of vessels: arteries, veins, and lymphatic vessels, each with a unique role in keeping your body functioning properly. Arteries are the body's highways, carrying oxygen-rich blood directly from the heart to all parts of your body, from your brain to your toes. These vessels have thick, elastic walls designed to withstand the high pressure of blood being pumped directly from the heart. This strong, flexible structure ensures that blood can reach even the farthest corners of your body, delivering the oxygen and nutrients your cells need to stay healthy. On the other hand, veins are the return routes. After your cells have absorbed the oxygen and nutrients, the used, oxygen-poor blood needs to travel back to the heart to be refreshed. Veins have thinner walls than arteries, but they come with a special feature: valves. These tiny flaps act like one-way doors, making sure blood flows in the right direction, back toward the heart, and preventing it from pooling in your legs or hands. This is especially important for seniors, as weak vein valves can lead to poor circulation, causing swelling or even varicose veins. The third component of this system is the lymphatic vessels, which are often overlooked but are just as essential. These vessels do not carry blood. Instead, they transport lymph, a clear fluid that is collected from tissues throughout your body. This lymph fluid contains waste products, dead cells, and other toxins that must be removed to maintain healthy tissues. The lymphatic vessels collect this fluid and return it to the bloodstream, where it can be processed and eliminated. In other words, they are your body's natural drainage system, protecting you from infections and keeping your tissues clean. Despite their unique roles, many people confuse veins with arteries. It is a common mistake to refer to any circulation problem as clogged veins, but in reality, clogged veins and clogged arteries are very different problems. Clogged veins typically cause symptoms like swelling, discomfort, or a feeling of heaviness in the legs. These issues are often related to blood not returning efficiently to the heart, which can result in conditions like deep vein thrombosis or varicose veins. In contrast, clogged arteries are a much more serious issue, because arteries deliver oxygen-rich blood to your organs. Any blockage here means that your cells are being starved of oxygen. If an artery in your heart becomes clogged, it can lead to a heart attack. If an artery in your brain is blocked, it can cause a stroke. Unlike clogged veins, which can often be managed with lifestyle changes, clogged arteries usually require immediate medical attention. Understanding the difference between these vessels is the first step to protecting your circulation health. While clogged veins can cause discomfort and even pain, clogged arteries are life-threatening and must be treated immediately. Knowing how your arteries, veins, and lymphatic vessels work together helps you recognize the warning signs of poor circulation and take action before a minor problem becomes a serious health threat. Poor circulation is a condition that many people, especially seniors, may experience without even realizing it. It can start with subtle signs, those little sensations you might brush off as nothing serious. But recognizing these symptoms early can make a huge difference in maintaining your health. So what exactly should you be looking out for? One of the most common symptoms of poor circulation is a tingling sensation in your hands or feet. You might feel it as a slight prickling, almost like tiny pins and needles. This often occurs because your blood is not flowing properly to the farthest parts of your body. In more severe cases, this tingling can turn into full numbness, where you lose all feeling in certain areas. Another common sign is a persistent cold sensation, especially in your hands, feet, or even your nose. Even when the room is warm, your fingers and toes may feel icy. This happens because the blood, which normally brings warmth to your tissues, isn't reaching these areas effectively. Swollen legs are another classic symptom of poor circulation. If you notice your legs, especially your lower legs and ankles, becoming swollen, especially after sitting or standing for long periods, this could be a sign that your veins are struggling to return blood to your heart. When blood pools in your lower extremities, it causes that heavy, swollen feeling. Sometimes, the skin around these areas may even change color. It can appear pale, blue, or purple, which indicates that oxygen-rich blood is not reaching those tissues. Cramps in the legs, especially during activity, are another clear indicator of circulation problems. If you are walking, climbing stairs, or even just standing for a while and suddenly feel a painful cramp in your calf or thigh, this could be due to poor blood flow. Your muscles aren't getting the oxygen they need, so they start to spasm, causing pain. In severe cases, these cramps can even happen when you're at rest, interrupting your sleep. When poor circulation affects your heart, the symptoms become even more serious. You might experience chest pain, known as angina, especially when you are active or stressed. This pain happens because the heart muscle itself isn't getting enough oxygenated blood. It can feel like a squeezing or tightness in the chest, and in some cases, it may spread to your shoulders, arms, or jaw. But poor circulation doesn't just affect your hands, feet, or heart. It can also impact your brain. When the arteries in your neck, known as the carotid arteries, become clogged, the blood supply to your brain is reduced. This can cause dizziness, confusion, memory loss, or even sudden fainting spells. These are warning signs that should never be ignored, as they may indicate a higher risk of stroke. It's also important to understand that not all circulation problems are the same. There is a key difference between acute and chronic blockages. Acute blockage happens suddenly and can be life-threatening. For example, if an artery in your heart suddenly becomes blocked, it causes a heart attack. This is an emergency situation that requires immediate medical attention. The same goes for a stroke, which occurs when a blood clot blocks an artery in your brain. Symptoms appear suddenly and can cause permanent damage if not treated quickly. On the other hand, chronic blockage develops slowly over time. You might not even notice it at first. Maybe your legs feel tired after walking a short distance, or your hands and feet seem colder than usual. Over time, these mild symptoms can become more severe. You may notice that you can't walk as far as you used to without feeling pain, or your chest discomfort appears more often. Unlike acute blockages, chronic ones allow the body some time to adjust. New smaller blood vessels may form to bypass the blockage, but this is not a perfect solution, and the problem will continue to get worse without proper care. Recognizing these symptoms early is your best defense. Many seniors accept these signs as just part of getting older, but they are actually signals from your body that something is wrong. Don't ignore that tingling in your fingers, those cold feet, or that chest discomfort. By understanding these symptoms and paying attention to your body, you can take action before a minor problem becomes a serious health crisis. Ignoring circulation problems can be a dangerous mistake. What starts as a mild discomfort, like tingling, cold feet, or occasional cramps, can turn into something much more serious if left untreated. Understanding the potential risks of untreated blockages is crucial, because these conditions can rapidly escalate into life-threatening emergencies. One of the most severe consequences of poor circulation is a pulmonary embolism. This occurs when a blood clot forms in a vein, often in the leg, and then travels to the lungs. Once the clot reaches the lungs, it can block blood flow, making it difficult to breathe, and placing immense pressure on the heart. Symptoms can come on suddenly and include sharp chest pain, difficulty breathing, a rapid heartbeat, and even coughing up blood. A pulmonary embolism is a medical emergency that requires immediate treatment. Without quick intervention, it can be fatal. Another severe risk is a heart attack. Your heart is a muscle, and just like any other muscle in your body, it needs a constant supply of oxygen-rich blood to function properly. When an artery that supplies blood to the heart becomes blocked, the heart muscle is starved of oxygen. This results in a heart attack. Symptoms of a heart attack can vary, but they often include severe chest pain that may radiate to the left arm, neck, or jaw, shortness of breath, sweating, nausea, and a sense of impending doom. A heart attack is always an emergency. Every minute counts, because the longer the heart is deprived of oxygen, the more muscle tissue is permanently damaged. Stroke is another life-threatening consequence of a blocked artery, but this time, the blockage occurs in the brain. When an artery supplying blood to the brain becomes blocked, the affected part of the brain is cut off from oxygen. Within minutes, brain cells begin to die. The symptoms of a stroke are sudden and include numbness or weakness in the face, arm, or leg, especially on one side of the body. You may also experience confusion, difficulty speaking, blurred vision, dizziness, or loss of balance. In the worst cases, a stroke can cause complete paralysis or even death. Quick treatment is critical. Medical professionals often say, "Time is brain," because the faster you receive treatment, the less damage is done. Peripheral artery disease, PAD, is another dangerous condition that can develop when circulation problems are ignored. PAD occurs when the arteries that supply blood to your legs become narrowed or blocked. This results in reduced blood flow to your leg muscles, which can cause cramping, pain, and muscle weakness, especially during physical activity. Over time, PAD can lead to more severe complications, including tissue death, infections, and even the need for amputation. For seniors, PAD can significantly reduce mobility, making everyday activities painful and difficult. The common factor in all of these conditions is that they are emergencies. When an artery is blocked, whether it is in the heart, lungs, brain, or legs, immediate action is necessary. The longer the blockage remains untreated, the greater the damage. For example, during a heart attack, heart muscle cells begin to die within minutes. During a stroke, brain cells die even faster. Pulmonary embolism can cause your heart to fail in seconds if the clot is large enough. This is why recognizing the symptoms of poor circulation and taking them seriously is so important. A simple tingling in your leg could be an early warning sign of a clot. A brief episode of chest discomfort might be a warning of a future heart attack. Dizziness or confusion could be a sign that blood flow to your brain is reduced. Do not ignore these signals from your body. If you or someone you know begins to experience symptoms of a heart attack, stroke, or pulmonary embolism, call emergency services immediately. Quick treatment can be the difference between life and death, between a full recovery and permanent disability. Knowing the risks and understanding the signs of a circulation emergency could save your life. Improving circulation is essential for maintaining overall health, especially for seniors. Fortunately, you don't need expensive treatments or complex medications to boost your blood flow. In fact, some of the most effective ways to improve circulation are simple, natural habits that you can start today. The first, and perhaps the most important, is regular physical exercise. Exercise doesn't have to be intense or exhausting. In fact, for seniors, gentle activities are the best. Walking is an excellent choice. It gets your heart pumping, improves blood flow to your legs, and is easy to do almost anywhere. Swimming is another great option, providing full-body movement without putting pressure on your joints. Cycling, whether on a stationary bike or outdoors, can keep your leg muscles active and your blood flowing smoothly. Light yoga is also highly beneficial, as it combines gentle movement with deep breathing, which can enhance circulation and reduce stress. The key is consistency. A little bit of activity every day is far better than a hard workout once a week. Even just 20 to 30 minutes of gentle movement each day can significantly improve your circulation over time. Another simple but powerful method to improve circulation is to elevate your legs regularly. Your veins have to work against gravity to bring blood back to your heart, and this can be especially difficult if you spend a lot of time sitting or standing. Elevating your legs helps blood flow more easily, reducing pressure on your veins. The best way to do this is to lie down comfortably and lift your legs so they are above the level of your heart. You can use pillows, a folded blanket, or a recliner chair to keep your legs elevated. Aim for 15 to 20 minutes several times a day. This practice can reduce swelling, prevent blood pooling in your legs, and even help with varicose veins. One of the most damaging habits for circulation is smoking. Cigarettes contain chemicals that damage the lining of your blood vessels, making them stiff and narrow. This reduces blood flow, increases your blood pressure, and makes your heart work harder. Over time, smoking can lead to severe circulation problems, including peripheral artery disease, heart attacks, and strokes. Quitting smoking is one of the best things you can do for your circulation and your overall health. But quitting can be difficult, especially if you've been smoking for many years. The good news is that there are many ways to get support. Consider talking to your doctor about nicotine replacement therapy, such as patches, gum, or lozenges. These can help reduce cravings while you gradually reduce your nicotine intake. There are also herbal alternatives, like ginseng or lobelia, which some people find helpful. You can also join a support group, either in person or online, where you can share your struggles and get encouragement from others who are also trying to quit. Remember, it's never too late to stop smoking. Even if you've been a smoker for decades, quitting can improve your circulation almost immediately. Within just a few weeks, your blood pressure can improve, your circulation can become more efficient, and your energy levels can increase. By making these simple changes, staying active, elevating your legs, and quitting smoking, you can dramatically improve your circulation. These are not just habits for today, but lifelong practices that will keep your blood flowing smoothly and protect your heart, lungs, and brain. Maintaining a healthy weight is one of the most effective ways to improve your circulation. Excess weight puts extra pressure on your blood vessels, making it harder for your heart to pump blood efficiently. This pressure can damage your arteries and veins over time, increasing your risk of poor circulation, high blood pressure, and even heart disease. Fortunately, losing even a small amount of weight can significantly boost your circulation and overall health. The best way to maintain a healthy weight is to focus on balanced meals, prioritize whole, nutrient-dense foods such as vegetables, fruits, lean proteins, and whole grains. Avoid highly processed foods, which are often high in unhealthy fats, sugar, and salt. Portion control is also essential. Instead of eating large meals that can make you feel sluggish, try eating smaller, balanced portions throughout the day. This keeps your metabolism active and helps maintain steady energy levels without overloading your digestive system. Staying active is another crucial part of maintaining a healthy weight. Even light activities like walking, stretching, or dancing can burn calories and keep your blood flowing smoothly. Along with maintaining a healthy weight, eating a balanced diet is key to supporting good circulation. Certain foods are known to boost blood flow naturally. Fatty fish like salmon, mackerel, and sardines are rich in omega-3 fatty acids, which reduce inflammation and improve blood vessel health. Nuts, especially walnuts and almonds, are full of healthy fats and magnesium, which help relax your blood vessels. Berries, such as blueberries and strawberries, are packed with antioxidants that protect your blood vessels from damage. Leafy greens, like spinach and kale, are high in nitrates, which your body converts into nitric oxide, a compound that relaxes your blood vessels and improves blood flow. On the other hand, it's essential to limit foods that can harm your circulation. Processed foods, which are often loaded with unhealthy fats, sugar, and salt, can damage your blood vessels and increase your risk of high blood pressure. Sugary drinks, fried foods, and excessive salt can all cause your blood pressure to rise, making it harder for your heart to pump blood effectively. By choosing foods that support circulation and avoiding those that harm it, you can maintain a healthy weight, protect your arteries, and keep your blood flowing smoothly. Knowing when to see a doctor about circulation problems can save your life. While some symptoms of poor circulation may seem mild at first, they can quickly become serious if left untreated. One of the most obvious signs you should never ignore is persistent pain, swelling, or discoloration in your legs. If your legs are constantly aching, if they appear bluish or purplish, or if they are swollen even after resting, this could be a sign of a serious blockage in your veins or arteries. Another warning sign is chest pain that doesn't go away with rest. Chest pain is always a red flag, especially if it feels like pressure, tightness, or a squeezing sensation. It can be a symptom of angina, which is caused by reduced blood flow to your heart, and it may even be a sign of an impending heart attack. Never ignore chest pain. Seek medical help immediately. Severe dizziness or sudden memory loss can also indicate circulation problems, particularly if blood flow to your brain is compromised. This could mean that the carotid arteries, which supply blood to your brain, are partially blocked. In extreme cases, this may lead to a stroke. If you ever feel sudden dizziness, confusion, or notice that you are having trouble remembering things, it is crucial to get checked by a doctor. Finally, pay attention to sores on your feet that don't heal. Poor circulation means that less oxygen-rich blood is reaching your extremities, which can slow down healing. If you have a sore on your foot that doesn't improve or seems to be getting worse, this could be a warning sign of peripheral artery disease. But why is seeing a doctor so important? The answer is simple. Early diagnosis can prevent serious complications. Many circulation problems can be treated effectively when they are caught early. Your doctor may recommend tests such as an ultrasound to see how well blood is flowing through your veins and arteries. An angiography may be used to get a detailed view of your blood vessels and identify any blockages. Blood tests can also help detect risk factors like high cholesterol, diabetes, or blood clotting disorders that can affect circulation. These tests are quick and can provide a clear picture of your vascular health, allowing your doctor to recommend the best treatment for you. Preparing for a doctor's visit is also important. Keep track of your symptoms. Write down when they started, how often they occur, and what seems to make them better or worse. This information can help your doctor make an accurate diagnosis. It is also a good idea to bring a list of any medications you are currently taking, including over-the-counter supplements. Some medications can affect circulation or interact with each other, so having this list can help your doctor make safe recommendations. Your health is too important to ignore. If you notice any of the warning signs we have discussed, persistent leg pain, chest pain, sudden dizziness, or slow-healing sores on your feet, see a doctor without delay. Don't wait until a minor problem becomes a major emergency. Early action can save your life. We've covered a lot of important information in this video, so let's quickly recap the key points. First, recognizing the symptoms of poor circulation early is crucial. Whether it's tingling in your legs, cold feet, chest discomfort, or slow-healing sores, these are all warning signs your body is giving you. Don't ignore them. Second, understanding how your circulation works. How your veins, arteries, and lymphatic vessels function is the foundation of maintaining good blood flow. Knowing the difference between a clogged vein and a clogged artery can help you take the right action if you experience symptoms. Finally, we have shared simple, natural ways to improve your circulation. Regular exercise, maintaining a healthy weight, eating a balanced diet, quitting smoking, and elevating your legs are all easy habits you can start today. But knowing these things is just the first step. To truly protect your circulation and overall health, you must take action. Don't wait until symptoms get worse. Start making small changes in your daily routine and encourage your loved ones to do the same. Share this knowledge with friends and family who may benefit, because good health is a gift worth sharing. If you found this video helpful, please like, subscribe to our channel, and turn on the notification bell so you never miss our latest tips. And don't forget to share this video with anyone who might need it. Stay connected with us for more senior health tips. Take care, and see you in the next video.